Chief Executive Officer of eHealth, Fran Soisman, joins me now with stress-free planning tips to help you save time and money during Medicare's annual enrollment period, which, by the way, ends December 7th. It'll be here before we know it, right? So let's get right into it. Thank you so much for joining me. Why is Medicare open enrollment stressful for folks, and what challenges are people facing as they navigate this?
Well, Jordan, thanks for having me first. Yes, this time of the year can be very stressful for a variety of reasons, but there is a window of opportunity each year that the government sets aside from October 15th through December 7th for seniors to evaluate their current coverage and whether that coverage is going to meet their needs going forward into the new year. So it is an important time to devote to really an assessment, a needs assessment.
All right,
and that will make the process a lot easier, particularly if you're working with a licensed agent.
Right. Okay. So then let's talk about some of the challenges and what people should consider when they're looking for a different coverage plan, because I know it can maybe sound a little confusing for some. So help us out there.
Well, it doesn't need to be stressful. It's about preparation. So I'll provide you some tips here. First, if you're an existing Medicare Advantage plan member, you would have received in August and September an annual notice of change. And that's your insurance provider telling you, here's what's going to change in your current benefit plan for the upcoming year. Second, take a health inventory. Decide, if your medical needs are going to be changing and what those needs are really, what those requirements are. Understand your prescription drug medications. Which doctor relationships are most important to you that you want to protect? What your personal financial situation is. Has it changed in this year? Is it going to change next year? And then to the extent that you know that you're going to have an elective procedure in 2024 that may require a hospitalization or outpatient surgery, that can be some of the greatest financial risk in terms of not having sufficient coverage. So it's important to know that in advance. Be prepared with your Medicare ID number. That will make the process a lot simpler. Clear some time on your calendar. Takes about an hour to go through the educational process, the comparison shopping process, and then the enrollment process. Lastly, it really is important to work with a licensed agent, an expert in Medicare, Original Medicare, Medicare Advantage, prescription drug programs, and Medicare Supplement, because your needs may be different from another family member's needs or a neighbor. So it's all about what your needs are, and he or she can best help you sort through that.
Right, and everybody's different. And I like that you mentioned preparation, because we still have time. Everyone out there, if you have not done this yet, you still have time to prepare. But if they want more information to help them prepare, where should they go, Fran?
What I would recommend they do is come right to eHealth's website. That's ehealth.com. Lots of information there that will help them navigate this process in a stress-free way. And that's the way it should be.
Definitely. Who doesn't like the sound of that? Stress-free. Well, thank you again for helping us out with that and being on our side as we are on our viewer side as well. And if you'd like to see this info again, or this interview, I should say, head to our website.